Good afternoon, guys, gals, my non-binary pals, and my fellow Americans. As your president, I will make this the generation to eradicate HIV. Although ambitious, this objective is both necessary and attainable. It requires our combined will, our pooled resources, and our unwavering dedication to justice, equality, and well-being. For many years, HIV has been a major worldwide health concern, and millions of people are still affected despite substantial advancements in prevention and treatment. This is a moral dilemma as much as a medical one. It is about our common humanity and our duty to make sure that everyone can lead a life that is both healthy and honorable. More than 700,000 Americans' lives have been lost to HIV since 1981. More than 1.1 million Americans are currently living with HIV, and many more are at risk of HIV infection. While new HIV diagnoses have declined significantly from their peak, progress on further reducing them have stalled, with an estimated 38,000 Americans being newly diagnosed each year. Without interventions, we estimate nearly 400,000 more Americans will be newly diagnosed over 10 years, despite the availability of tools to prevent transmission. The U.S. government spends $20 million in annual direct health expenditures for the HIV prevention and care. There's a real risk of HIV resurgence due to several factors, including trends in injection drug use, HIV-related stigma, homophobia, and transphobia, lack of access to HIV prevention, testing, and treatment, and a lack of awareness that HIV remains a significant public health threat. In order to end the epidemic, I am setting up a thorough, multifaceted plan to end HIV. Our strategy will involve the following major projects. 1. We plan to expand access to prevention and treatment. We will ensure that PrEP and PEP are available to everyone who needs them, regardless of their income or location. Access to antiretroviral therapy will be universal, free, and confidential. No one should face barriers to these life-saving medications. Number 2, we will strengthen public health infrastructure. We will invest in our public health systems to ensure that they are equipped to handle HIV prevention, testing, and treatment. This includes funding our community health centers, expanding mobile clinics, and supporting local health departments. Number 3, we plan to launch a national HIV awareness campaign. We'll initiate a comprehensive national campaign to educate people about HIV prevention, testing, and treatment. And this campaign will target all demographics, with special focus on communities that are disproportionately affected by HIV. Education will combat stigma, encourage testing, and promote safer practices. Number 4, support and fund innovative research. We will accelerate research into vaccines and cure options by increasing funding for the National Institutes of Health, and partnering with the private sector and international research institutions. Our goal is to support breakthroughs that will ultimately lead to a cure. Number 5, protect and expand health equity. We will address the social determinants of health that contribute to the spread of HIV. This includes improving access to education, healthcare, and economic opportunities, particularly in marginalized communities. Discrimination and stigma must be eradicated from all levels of healthcare and society. Number 6, we want to enhance global cooperation. HIV knows no borders, and neither should our efforts to combat it. We will strengthen our partnerships with international organizations, support global initiatives, and ensure that our efforts to end HIV extend beyond our national borders. We will contribute to global funding mechanisms and share our knowledge and resources. Number 7, provide comprehensive supportive services. We will ensure that those living with HIV have access to a full range of support services, including mental health care, substance abuse treatment, and housing assistance. A holistic approach is essential to improving health outcomes and quality of life. Number 8, we want to strengthen legal protections. We will work to eliminate discriminatory practices, decriminalize and protect the right of those living with HIV. Legislation will be enacted to safeguard against discrimination in employment, housing, and healthcare. Every American deserves dignity and equal treatment. Number 9, we want to foster community-based organizations. I will support grassroots organizations and community leaders who are already on the front lines of the fight against HIV. Their local knowledge and commitment are invaluable. Funding and resources will be directed to these groups to enhance their capacity and reach. We can eradicate HIV if we band together. This is a call to action as well as a vision. For the sake of future generations, of our loved ones, and ourselves, we must rise to the challenge. Our work will be prompted by achievements and guided by data. A task force will be formed to keep an eye on things, access results, and make sure the resources are being spent effectively and efficiently. At its core, our approach will be focused on accountability and transparency. Let our generation be remembered for coming together to put an end to a devastating illness. Let us move forward with empathy and unwavering resolve. May we set out on this path to eradicate HIV together. Good night, and God bless America.